Hi everybody, I'm Kelly with HealthyPlace.com. Today we're going to talk about psychosis, specifically bipolar psychosis. Our guest will be Arielle Bradberry and therapist Amy Quinn. You can find Arielle on Instagram at Picking Up the Broken Pieces, and Amy Quinn is at Amy Quinn, 2 N's, LMFT. Let's see here. We always welcome your comments and your experiences and your suggestions. We will talk about those as we go through the interview. And let me find Arielle. Let's see. There she is. Nope. Invite. Go smoothly. Here she comes. Hi,
Hello.
everyone. How are you today?
Good. How are you?
Pretty good. Pretty good. So let's do just a little background. How old were you when you first experienced psychosis, and how old are you now? And what's your current mental health diagnosis?
So I was 25 years old when I first went through psychosis, and my current mental health diagnosis is bipolar 2.
Okay. And so how long have you dealt with the psychosis? For how many years? About?
Well, it's 5 years because I was 25 and I'm 30 now. So
Okay.
I had 3 episodes within those 5 years.
Right. Okay. Let's see. So what in the beginning you weren't really diagnosed with bipolar disorder, right? So
No.
what did they tell you was the problem at first?
Acute psychosis.
Acute psychosis. Okay, so that's just a standalone kind of diagnosis, which is
Yeah, so it's brought on by stress.
okay. Okay. All right. So if you're just joining us, welcome to the show. We're talking about bipolar psychosis with Arielle Bradberry, and later on we'll have Amy Quinn. And please leave your comments and questions, and we'll get to those here in a little bit. So, the first time you experienced psychosis, what was going on? What kind of triggered the psychosis?
So I had a really stressful year. I was planning a wedding. I was working a dual job. Both my grandparents passed away, so I was grieving, and all the stress started happening. I was no longer sleeping at night. My husband worked the night shift, so I barely ever got sleep because as soon as I wouldn't be able to sleep until he got home, and then I would be up. So the lack of sleep and all the stress that was happening, I started thinking like, oh, I'm on top of the world. Like I'm so good at my job. I started having like these like feelings of empowerment, and then I went through the psychosis.
So that sounds like, was that a mania that you started with?
Yes. Now that I've been diagnosed, I can see where the mania comes from. Yes.
Okay, so that time, what hallucinations or delusions did you experience?
I thought that I was like black at one point. I'm obviously Caucasian, but I thought all sorts of things. I thought that I was of a different ethnicity. I thought that I had a different family. I thought that my family wasn't actually my family. I thought that I was pregnant at one time. There was all sorts of things. I would smell things that weren't actually there. I would smell like one time I thought my dad was smoking, which he does not smoke. And so I hallucinate smells and different things. I never really saw things that weren't there besides the fact that I saw myself as being black, but
That's really amazing to me. I've never heard, so when you looked in the mirror, did you see a different skin tone, or did you just, how does...
I think I visualized it. I visualized that I was a different skin tone where I was looking at myself, still seeing it, but I was like, no, that's not the reality. I'm actually a different color.
That's amazing. That's really amazing. When did you have your children? Was it after the first time or the first psychosis? It was after the first one.
Years
Um, who was with you when you experienced that first psychosis? Who took care of you, and how did you come to be, treated at the hospital?
Oh, sorry. Nobody was with me when I first went through psychosis. My husband was working night shift, so I went home to our apartment. I was all alone, and I went into the shower, and then all of a sudden I just started swearing and cursing, and I just felt something is wrong. So then I actually called 911, and I went into the hospital, and that's when everything just kind of started. They were asking me all sorts of questions. I had no idea how to answer them. Like, they thought that I was on drugs. I got to the hospital, and I fell to the ground and started screaming and kicking like I was a child, having a temper tantrum.
Daisy Cebu says, this is such a good and brave conversation. And you are very brave for talking about this. This is things that people will ever experience, and it's hard, to kind of understand it unless you've been through it. So thank you for talking about it.
Thank you.
I was thinking, so you went to the hospital all by yourself because you were exhibiting behavior that you knew wasn't right, and the cursing. Is that correct?
Yes. I felt like I was in a trance and that my whole life was going to happen, and that I didn't know like how it was going to happen. And I thought I had multiple personality disorder, so I thought that this was part of a psychological study, and I had to call in, and then I would go, and I was going to be like super famous for being having multiple personalities, and like this was the last stage of everything.
That's pretty big. Now, was it scary at all when it was going on before you called 911? Were you scared about what you were believing and smelling and all of that?
I wasn't really. Like, I was excited. I was more like, I'm gonna be famous, this is incredible, like everyone's gonna know. And I heard one of my friends, I heard voices too that weren't actually there. So I heard a girl that I grew up with saying, you're finally gonna be effing famous, and like, so I heard it was a lot of cursing, which is funny because like I don't really swear, and but I could hear like everyone. So everyone that's ever been a part of my life was part of the psychological study that I thought I was in. And so like as I was going down the hall, I wasn't looking, and everyone was there, all my previous bosses, everyone. So I just thought that I was super famous.
How long did that first psychosis last, like from beginning to when you came out of it?
I would say almost 3 months.
Wow. So it kind of started low key and then built up from there?
Yeah.
Okay. So 3 months, that's a good bit of time. Were you in the hospital for most of that time?
Yeah, almost 2 months in the hospital, and I was out of the hospital after a while, and then I had a really bad episode and ended up back in the hospital again.
Okay. We have a comment from Mikey. He says, that's amazing. So you were psychotic, but you were able to realize that you were psychotic. Is that correct?
I had no idea I was psychotic. I just thought that I thought I had multiple personality disorder and that I was going to be famous. So I needed to call 911 and go to the hospital, which is where the research study was going to be.
Okay. Oh, okay. So that's your delusion actually got you to the hospital is kind of what happened.
Yeah, that's kind of what happened. And I also just knew like there's something totally wrong with me. Mm-hmm. And I kind of was like, it's finally happening. I finally am going to know what's wrong with me and everything.
Mm-hmm.
Very
wow.
Interesting.
All right. So tell me a little bit about the time between your first experience with psychosis. What was kind of going on in life, and what, if anything, triggered the second one?
The second one? So the second one was just a day of psychosis, and it was after my son was born. So in 2017, I was not getting any sleep at all because I was absolutely terrified because he was my first baby. I would wake up in the middle of the night holding my pillow and thinking that I was smothering him. I was super scared all the time. Every time is he breathing? Is he breathing? I was terrified. And then one morning I was like, I want to be the best wife and mother. So I like got up really early to make coffee for my husband. And then my son woke up, so I was holding him and I was singing songs to him, and then I started singing louder and louder, and then I just went into a full-on scream. And then my husband came in and I started repeating and saying, like, I'm in a trance, my whole life is going to be over, my son is going to grow up and I'm going to have absolutely no idea, and then I'm going to have another baby, and then this is going to happen and I'll have no idea, and then I'm going to die.
Wow. Now, was it scary that time?
Yes, extremely scary. Because after about 10 minutes, I actually like came out of it, but I was still scared. I still like was confused. And then we decided, like, we called my entire family, said we have to go to the hospital. So I had to drop off my newborn baby at my sister's house. I was breastfeeding, so she would have to give him formula. And I had to go to the hospital, and I was absolutely terrified that I was going to have to stay there for a long time and that I would never see my baby again. Wow. So it was the most terrifying moment. And when I got there, I kept saying, left brain, stay in the present, stay in the present. And I kept trying to, like, I thought that it was a part of my brain that was acting up, and that if I said left brain, that my body would keep thinking left brain for some reason. And then I went home and I was still kind of distorted, but then I didn't end up taking my medication that they prescribed, which was the same as the last time I went through it, and then I was fine. I got sleep, I started doing self-care, and then I was fine.
How did your husband react to all of this?
The second time he was, terrified and like super upset because he didn't, like, the thoughts that were going through his mind is my wife going to be in the hospital for another 3 months? Is she going to be sick? Like, is this how she's going to be the rest of her life, is kind of what he thought. And like the first time they thought, like, is she ever going to come out of this? Like, is this going to be our new daughter? She's going to live in a hospital the rest of her life. So yeah, he was absolutely terrified. More terrified the first time because it was all new, and then the second time was like, how long is this going to happen?
My goodness. So that's the second time it happened. Now, what was the last time? The third time that you've gone through it?
Third time. Sorry, the third time I was just over 8 months pregnant. I had a really stressful Christmas. My brother-in-law was being my brother-in-law, not a very good character. He's an alcoholic, was an alcoholic. And so we had a lot of family drama happening. It was my first Christmas that I was hosting. So I was super stressed. And then my son was super sick, my other son, so the 3-year-old. He was extremely sick to the point, like, his fever was super high, and so I was fine for Christmas. Everything just kind of went like as if I was in a trance. We ended up going to the hospital that night because of my son, and then the next day I felt super relieved. I was super happy that Christmas was over. And then all of a sudden I started doing that trance-like thing, saying my life was going to be over, and I was saying all sorts of different things. And then I went into the psychosis. So my family called 911. I was running around my house screaming, I will find you, I will find you. I'm just going to make up a name. I forget what name I used in my book, but Rachel, I will find you. I will find your daughter. I will find your daughter. I thought there was a missing daughter and that I was supposed to find her, and that she was down the street and she had been taken, like, abducted at a young age, and that she lived on my block. So I was running down the street just screaming, and the paramedics kind of grabbed me and put me in the ambulance. And I was screaming, I don't want to go to that hospital. I don't want to go to that hospital again. Because it was, being in that hospital was the most stressful thing. And I had so much postpartum stress from it. And but then they realized I was just way too bad, so they had to take me to the nearest hospital, which I had been to before.
Mm-hmm. Goodness gracious. Sissy says, I see your child. Do you ever worry that you will have a psychotic episode while caring? That is a little boy, right? You have 2 boys?
Yes, this is Elroy.
Okay.
He's teething, so he's been really grumpy, but he seems to be happy now. This is Elroy. He's 9 months old.
So Sissy's wondering if you're worried you'll have a psychotic episode while you're caring for your children.
I'm not worried because I know the signs. I know what, if I start to get stressed or that, my husband won't go to work. So he is very comfortable with his bosses. They know everything that's gone on with me, because when I went through postpartum depression with this little guy 9 months ago, he had to take off almost 3 months work, and they were super understanding. And so they said if anything ever happens, he just drops his tools, drops everything, and comes home. So for me, I'm not afraid because I know what triggers me, and I know if I'm stressed out, then he needs to stay home with the children.
So you know,
but I mean, I would be there. Sorry, I would never be alone.
Right. I just had something I was going to ask you. Okay, so when you're actually about to experience psychosis, like what are those signs that
oh, sorry.
That's okay.
The
What
signs
are the signs that you notice? Mm-hmm.
I wrote them down one time when the last time I went through psychosis, but typically I start to reach out to random people. I start to like have all these feelings of wanting to help people, which I already do have feelings to help people all the time because that's just how I am. But it's like a more innate, like intense version of it. And then I start to feel like super upset and stressed out. And then all of a sudden I just have this huge feel of relief. And the feel of relief is usually the part where I go into the psychosis. So the first time I was super relieved because I just moved back to my old office. So I was working out of another office that was super, super busy, and I had to terminate 2 employees. And then I was finally going to be back at my quiet, nice office. Mm-hmm. And then it was like this huge sigh of relief. Oh, it's okay. It was like a huge sigh of relief. You want the phone. You want the phone.
So
yeah, so that's kind of how it triggers.
So you wrote them down. Is that so if you start feeling off, you can review them? Is it like, how does that help you?
Yeah, it kind of helps me, and it's kind of how I almost diagnosed myself in a way. Like I did, like they said that they thought like it could be possible the person has bipolar, but then they never diagnosed me. And then I kind of diagnosed myself. I was like, I am definitely bipolar. Like all the things that happen are totally like, they're what I do. So I kind of wrote down each step of like how it happens to me, and it really helps just to know what's going on. And I think it's also in my book, Picking Up the Broken Pieces.
Yeah, we'll talk about that a little bit more here in a minute. So let's see, what has helped you most in dealing with psychosis?
I would say learning my triggers and learning what I can handle. So I know that I'm never going to do a job that stresses me out, and if it does, then I leave. Like I don't stay in an uncomfortable situation. I've been working for the same company for 3 years now, so I know that job doesn't stress me out, and when it does, I talk to someone about it and I explain myself, and I just have learned to be an advocate for myself. So I know when something is stressing me out, and I tell everyone. when I need something, I tell everyone. And that's what I've kind of learned over time, is that you can't be silent. You have to tell people what you need, and you need to set your own boundaries. And for me, I do a lot of self-care as well to make sure that it doesn't happen.
Mm-hmm. Those are good. What advice, what advice do you have for people who, I guess, who know they've been psychotic in the past, or maybe afraid of that happening again? You know, do you have any advice for them?
I would say definitely speak to a psychotherapist or any, like a psychologist, a therapist, on a regular basis, because you get to know them, and then they start to know what your triggers are and when you start to decline. Or for me, like being a bipolar, she'll notice if I'm super upbeat and happy one day and then super low and a different type of mood. So getting somebody on your care team, also having a family member that's close with you that can understand your triggers. Like my husband understands. When I was getting way too involved with social media, I started buying things online, and I just started doing all these things. And he was like, you need to take a break from social media. There's something going on with you. You're on this like extreme high. You think that everything's wonderful. You think that, you know, and with my book, he's like, you're promoting your book so much that you're overwhelmed, and this is not good for you. So having somebody on your side that can notice when your triggers are, or what's happening in your life. So someone to talk to.
All right, before we go, tell us just a little bit about your book.
Okay, so my book is called Picking Up the Broken Pieces. And so it's a memoir on my experiences. It first talks about myself and what kind of personality I am, and then it goes into my first episode of psychosis. It goes into what happened when I was pregnant, when I just had my son. I know. And then it was, sorry. He's teething and he's just not having it.
So can people get it at Amazon, or if they like visit your Instagram, do you post about it so they can find it there?
Yeah, they could go to the website through my website on my Instagram, but the best way is just to look up myself on Amazon, and it's Arielle Bradberry. So it's a book that has a big, beautiful butterfly on it.
Well, thank you so much for being here, and I hope your little boy feels better soon. I know what that's like. And
thank you.
Yeah, thank you for being so open and sharing.
Yes, thanks so much for having me. It's been such a delight.
I'll talk to you soon.
Okay, thanks.
All right. Our next guest is Dr. Amy Quinn, licensed marriage and family therapist. She presented at the Eye Movement Desensitization and Reprocessing Conference, so the EMDR conference, with her poster entitled A Call for Treatment Protocol for Bipolar I Disorder and EMDR. You can follow her at Amy Quinn, LMFT, and I hope you will do that. And let me bring Amy on. Now my phone is searching. There she is. Okay, good. Hi, Amy. How are you today?
I'm good. How are you?
I'm pretty good, thank you.
Good. Happy New Year.
Yeah, Happy New Year to you too.
Thank you. I know.
So that I have never heard psychosis described that way. Is that something that you see often?
Yeah, I think for everybody it's a little different, but I've definitely heard of people sort of feeling out of touch with reality, but kind of having rapid thoughts and connecting, making these connections and sort of this grandiosity, elevation of self and mood. And so that's all pretty common, especially with bipolar disorder that has psychosis, because part of the bipolar mania is to have this inflated self-esteem, decreased need for sleep, and then all of those things combined with the hallucinations and the delusions kind of create this grandiose idea of the world or yourself, or kind of what you're experiencing in that moment.
Mm-hmm. How do you know? Okay. What is the difference between a bipolar mania, when you feel, grandiose and, on top of the world and whatnot, and psychosis? How do you differentiate between the two?
Right. So there's primary psychosis, and that is when you have a disorder where the primary feature is psychosis. So like schizophrenia, schizoaffective disorder, the prominent feature, the prominent symptom is experiencing those delusions, hallucinations. And then when you have bipolar disorder, you can have bipolar disorder, with psychotic features, and that is a secondary psychosis. So basically primary is when the psychosis or the psychotic features, the delusions, the hallucinations are the main part of your mental health issue. And then the secondary psychosis is when it's really not the predominant part of your illness. So if you have bipolar disorder, it's predominantly a mood disorder, but you could have psychotic features, which means the psychosis comes up, usually in a manic episode or extreme times of stress. And so it's not the primary feature of your diagnosis.
We have a question. What's the difference between hallucinations and delusions?
So hallucinations are really, you're hearing things, or you're seeing things, or you're like smelling things, like Arielle talked about, that aren't there. So you're hearing things. Delusions are like, you're thinking things that aren't true, or you're having these ideas in your mind, not necessarily hearing things, but they're things that are like, they're not quite true. They don't quite add up. They don't quite make sense, but they make sense to you. But they're not actually what's happening in reality. Like Arielle talked about, saving a child that was missing, and maybe that's true at some point that a child is missing, but not necessarily true that she's going to save a certain child, that's out in the street that she's running after. Like a delusion can feel like it's true, but it isn't necessarily what's happening in reality at the moment.
But, when some people have psychosis, they experience thinking that they're an alien, or I've heard some people have a delusion that they are actually dead. Those things just couldn't be true. Well, the dead part could not be true.
Right. No, so they actually make the distinction in the DSM of, what type of delusion you're having. So one type of delusion is actually one that could be true, maybe, something that makes sense and could be true, but is not true in the moment. And then there are and they make the distinction of delusions that, couldn't happen. So.
Okay. And can you only experience one of those things, hallucinations or delusions, and still be considered psychotic?
Yes, it could be one or all. So.
Okay. Okay. And I was just wondering, as a person with bipolar disorder, how common are these psychotic features with that disorder? Is that like something anybody could experience, or is it, if you haven't been psychotic yet, you're unlikely to be? Is there any way to tell?
I think that it will happen during, your mania period. And, I don't really know the percentage of how much. That's something I would have to look up. But, I think it could, even if you didn't have the psychotic features in the first episode, you might have it in a second episode. Sometimes your first episode could be less severe than maybe your next episode or your next episode. So it's something to be on the lookout for. You might be diagnosed as bipolar disorder without psychotic features, and then you don't have them. But that doesn't mean that you might not get it later. But usually, you know, it follows a certain trajectory. So if you've had it once, then probably when you have your manic episode again, if you get to that point, of high stress and it's a really severe manic episode, then you know, you will most likely have those psychotic features again. But like Arielle talked about, you can be on kind of guard, or you can be aware of what some of your early warning signs are so that you can catch it early and you don't get to that point of this kind of severe psychosis.
Okay. Daisy Cebu is asking, and Daisy, Dr. Quinn does not treat Arielle. So how did you get her to realize her triggers? That wasn't something that happened between Dr. Quinn and Arielle. But she,
Right.
how would you have somebody, is that something you would ask them to do, you know, if they are experiencing psychosis?
Well,
How would they do?
Yeah, I probably wouldn't do it when they're actually experiencing the psychosis, because it's very, you know, once you're in the state of psychosis, it's very hard to kind of speak rationally and have that kind of a conversation. But in treatment, that would definitely be, as soon as they were, you know, able to kind of get into treatment and talk about those things, that would be one of the first things that I would do. I would, you know, say, look back on that and look at what was happening before you went into the psychosis. Like Arielle talked about, she notices when she's stressed out, she notices when she's reaching out to people. Some of the other symptoms for people could be you're isolating, or, you know, you're not talking to people, or you're talking too much to people, or maybe it's your sleep is off. That's a huge thing with bipolar disorder. When your sleep gets off, that really seems to kind of be an early warning sign that things are off and that you need to kind of maybe pull back from whatever you're doing. Make sure you're, you know, if you need to take a couple of days off of work, get your sleep back to where it needs to be. You know, that's really important. And, you know, have your support system, have the people that really know you and that can say, hey, you're talking a little bit faster today. You know, you seem to be a little bit more elevated, like Arielle talked about, like, let's, you know, talk about this, like what's going on, you know, do we need to, like, you know, take a little bit of a break, take a mental health day, maybe don't drink caffeine for a couple of days, whatever it is, you know, that's triggering you, just be aware and then kind of, you know, start treating yourself, or see your therapist, see your psychiatrist, maybe they need to up your meds. All those things can really help prevent your episode from really getting to a place where you're having those, you know, out of touch with reality and you have to go to the hospital.
So tell me a little bit about EMDR and bipolar and psychosis. I didn't even know you could treat bipolar with psychosis. With EMDR.
With EMDR, yeah. So that was what my poster was about. It's basically, the idea is that when you have a manic episode, it can be very traumatizing. Like the symptoms of a manic episode, you know, some of the goal-directed activities, some of the things that, you know, maybe you're staying up late, maybe you're, you know, talking a lot, talking to people that you wouldn't normally talk to, or, you know, just your life is different, you know. And so, you know, what I had mentioned in my poster is that a manic episode can be traumatizing, and, you know, going into especially if you have psychotic features, that could be traumatizing, because the elements of trauma is being out of control in some way, and that is definitely a way of being out of control. So the idea of treating bipolar disorder with EMDR is saying, hey, if you've had a manic episode and or psychosis, and you were hospitalized or not hospitalized, but you found that manic episode disorienting and traumatizing, you might need to, in addition to treating your bipolar disorder, you might need to treat your trauma with EMDR. And so that's what that poster was about. And it was just talking about, with people that have bipolar disorder, there should be a special protocol for EMDR therapists to address that. And, you know, I have done that with certain clients, and that's what I talked about in my poster, how effective it was for the case study that I did for the person that did have bipolar disorder, and that we did do some trauma work on their manic episode. And it actually really did help them to kind of, you know, get past the trauma of it and then kind of go on to have a more stable job and just be able to kind of, you know, get past that and heal from that.
We have a question. Well, first, Michelle, I want to say Reagan from England says, thank you for clarifying the psychotic definitions. I appreciate the straight talk. So that's good. And then we have a question right here. I can pull it up. Ladies be feminine. Do you think poor nutrition plays a part in creating the two disorders, or either agitate or agitate them? I see it. Yeah.
Yeah. I don't know about creating the disorders. I do know that genetics plays a huge part in mental health issues. So genetics is huge to look out for. If you have anybody in your family that has had a mental health issue, then, you know, be aware of that and be aware of your own symptoms. I do think that once you have the disorder or the illness, you do need to actually watch out for your nutrition. That nutrition, in addition with sleep and stress levels and all of those things, just kind of play a whole holistic part of, you know, whether or not your symptoms are, you know, come on or not. So you need to be aware, oh, you know, I'm drinking a lot of caffeine right now. Maybe, you know, that could affect, you know, your sleep. So if your sleep is affected because you're drinking a lot of caffeine, then you might be more likely to, you know, have some symptoms of mania. So just all of that stuff to be aware of, become like an expert on your own symptoms and your own triggers, and just be very self-aware.
Well, thank you so much for being here. I think it's about time to wrap up. So, Amy, thank you for all that information and for coming on again. I really appreciate seeing you here.
Thank you so much. Thanks for having me.
Okay, I'll see you in a couple weeks.
Okay, sounds good. Bye.
So, thank all of you for being here today and taking part in our Instagram Live. You can visit HealthyPlace.com to learn more about bipolar disorder, its treatment, its causes, its effects on your life, and all other mental health conditions also. I guess all I have to say is Happy New Year, and I will see you again in a couple weeks here on Instagram Live. And thank you for being here. And